What up, y'all? Welcome back to my channel. If you're new here, I'm Brianna, aka at You Ready Be. So catchy like Beyonce, I love it. Anyways, welcome back to the channel. I hope you guys have been enjoying all the content that I've been posting so far. If you don't know, I started a new schedule. All videos will be posted every Thursday and Sunday at 6 p.m. Eastern Time. So, y'all already know what I'm about to say before we get started. Make sure you're subscribed. If you haven't seen the latest videos, go ahead and view them. Like, comment, share with your friends, and make sure you tap that bell so that you can get notifications for new videos every Thursday and Sunday. So, today we have a new topic. We are going to be talking about pre-op nursing and PACU nursing, or preoperative nursing, which is getting patients ready for surgery, and post-op or PACU nursing, which is recovering the patients once they are out of surgery from anesthesia. The heading is gonna be peri-anesthesia nursing. That is exactly what it's called in the textbook literature or whatever, but you may hear people shorten it as pre-op and PACU nursing. So we're gonna jump right into it. As you guys all know, I am a pre-op and PACU nurse, and I have been that for a little over a year now. Wow. I started last June. So I work at the Children's Hospital here in Washington, D.C., and I was just really excited. I don't even know how I kind of embarked on the journey, because I always just felt like, ooh, I want to do ER and trauma, which I've done, and I'm trauma certified. And so I knew that, my kind of wants and needs in nursing kind of took a turn, because I was really, really infatuated with, the surgery realm. And I wasn't sure if I wanted to actually be in the OR. And so I started trying to find jobs that were pre-op and PACU nursing, or preoperative nursing and post-operative nursing. And I was just trying to figure out, talk to a couple of nurses, figure out how I could get into this specialty of nursing. And I kept hearing that it's a great place to go, especially when you're in school like me. It's a great job to have. And everybody always used to tell me this is where nurses go to die. And I was like, what do y'all mean by that? They mean that nurses I have a lot of nurses that I work with, very seasoned. Half of them have been in the pre-op and PACU realm for about 10 years or close to 10 years. Some 20, they've been doing this for a long time, vets in the game, okay? And so I was just like, darn, why does everybody like that? And then a lot of people were telling me that it's hard for jobs to open up there because nurses stay there so long, they're not really looking for staff, because they have their staff and have had them for the last 5 to 10 years or beyond. So I'm like, dang, and for me, once I become a nurse practitioner, I really, really, really want to work in aesthetics or an ambulatory care surgery center, or something that has to do with plastics. I really am interested in doing plastics. And so that's kind of what shifted me to start in this specialty. Another thing was, I felt like on my resume, if I have, pre-op nursing, PACU nursing, or some kind of anesthesia background, once I become a nurse practitioner, I would be more appealing on my resume to those kinds of places where I want to apply to and work at in plastics. And, I have a couple friends, and they have gotten some work done, and they've told me that, the nurse practitioner that kind of checks up on them and does their checkups, like, 1 month, 3 months, 6 months, or whatever, that they're really good and they make a lot of money. And even though we're not always in it for the money, we want to love what we do. However, a bomb ass salary is a plus. Well, it's definitely a plus, but it's also got to be in there somewhere. So that is my spiel. That is how I started this whole journey in pre-op and PACU nursing. Now you might be asking, how did I get from emergency trauma nursing to pre-op? So how do you jump specialty to specialty? Hold on, I'm gonna tell y'all in just a second. So the reason why I started in the ER, well, I didn't start in the ER, I started in cardiac med surg, which that is where I got my foundation, that is where I got my skills, and that is where I learned how to time manage and really, just take care of patients the way they need to be taken care of, but in a reasonable amount of time. Because we would have 5 patients on the floor. When you have cardiac, most time they have diabetes management or something else is going on with their kidneys, something's going on. Once the heart goes wrong, everything kind of goes downhill. So that really was my foundation. However, I took that and went into ER nursing, which was bomb because again, I learned my skills, but that's where I got trauma certified. So that's where I started seeing, the gunshot wounds, stab victims, different kinds of things like that. And I loved working trauma. However, when school started, it became a lot because being in the ER is kind of stressful. Well, not kind of, it is stressful. Working trauma is more stressful. And when I got to DC, I was working at a level 1 trauma center. And so it was always a hustle and bustle, not really any much downtime or anything like that. Maybe from 3 to about 6:30 or something, maybe we had downtime depending on what kind of night it was. And so for me, I just was like, darn, I need a shift, I need a change, and I really wanted to work in surgery. Let me see what this is like. So I really was just kind of going out on a limb, but I know that having ER background really puts you in the door for a lot of things. It could take you to ICU, it could take you to OR because it's considered critical care. And that is what people are looking for when you are pre-op or PACU. Now, I don't know if that's necessarily true for pre-op, but for me, at my job, pre-op nurses float to PACU. So when we have our orientation, we orient in the post-anesthesia care unit and on the pre-op side. My home is pre-op. However, if it's my turn to float, I will go to PACU. So I need to be quick on my feet with my skills, knowing anesthesia and how to recover these children from anesthesia, what to look for in the surgeries that they get. We do a lot of, tonsils and adenoids, a lot of Botox injections for our quadriplegic patients. We do kidney biopsies, liver biopsies, all kind of stuff. And so you have to know those disease processes in and out, especially when you're doing PACU nursing. You get better with time. So I don't want that to scare you guys, but this is how I kind of, made the switch. So my ER nursing and trauma certification really got me in the door. With that, I also have my psych degree and stuff like that. So I really think that is like a bundle, great package, and it's great. So I got the job, and I had an extended orientation period because of the fact that, I was new. Any specialty you jump from, you have an extended period of orientation, which was fine with me. And I was coming from adult nursing and going to pediatric, so that was a whole nother situation. But anyways, in pre-op, what we usually do, and I think that pre-op really sharpens your assessment skills because you have to be on top of, is the patient sick? What does their skin look like? Their vital signs, things of that nature. So pre-op is basically getting the patient ready for surgery. So when we come in, a regular day looks like, for me, I'll get a patient, they'll come in, I talk to the parents, and we ask a questionnaire. While we ask about what time they last ate because they need to be fasting. We ask about recent sickness, fevers, cold, cough, anything like that. Any recent travel outside the country, that's standard for everybody after the Ebola breakout and all of that other stuff. And then we ask about history, family history. Do they have any cardiac problems, heart problems, breathing problems, asthma, anything like that? Because once you're put to sleep, you're under anesthesia. We need to make sure your airway is good. If you have, some kind of issue with your airway, we need to know how to treat it while you're in surgery or if you come out and something happens. So definitely that is a good piece. Do you take your inhaler every day? How many times does the child take their inhaler? Different things like that. So we also ask anesthesia history. Have they ever had anesthesia before? Do you have any family members who had a reaction with anesthesia? Mainly MH. And MH is malignant hypothermia is what they're looking for. So definitely look that up because that's important. And then sometimes people have different allergies like to egg or something like that, and those are in the anesthetics that they use, not mainly the gas, but maybe something else. So we get all of that done. Then we go down to getting the weight. The weight is really important for us in pediatrics because that is how they base the medication and what is safe for the child to have. So we get height and weight, vital signs, change the patient, put them in a gown, all that stuff like that. Another thing that you need to be mindful about when you want to be in pre-op nursing is the consent, okay? You need to make sure the consent matches what the child is getting. Otherwise, if it is discussed with the parents that they may be getting something else, then you need to make sure that it is written on the consent, that it matches what the parents are saying and what the surgeon is saying. You also want to make sure that the surgeon marks the site. So if I'm doing surgery on my right arm, I need to make sure that there's an initial on the right arm and everybody in the room is in agreement about the fact that this is the arm that the surgery is going to be on. Because if they make a mistake and do surgery on the left arm, now we got a problem, okay? And so these are all of the steps that we take in pre-op nursing to make sure that the child is ready to go back for surgery. Now, I just was blessed because I was working PRN at another PACU place, at another hospital in the PACU, but I was working with adults. So now I got the best of both worlds because I'm able to see how adults react after anesthesia, what their pain may be like, what kind of surgeries that they normally get. And on the pediatric side, I'm able to see what's common, what we're looking at, different things like that. And so I got the best of both worlds. So I'm really happy about that. Anyways, so pre-op nursing, your charting has to be on point, assessment skills has to be on point, interviewing the parents have to be on point, especially with teenagers. Just because the mom said that the patient didn't eat, since yesterday doesn't mean that the teenager didn't sneak and get something to eat. It's very important because, if you don't fast and they put you to sleep, they put a tube down your throat, to help you breathe while you're sleeping, you could potentially aspirate or, throw up and it be in your lungs. And so we don't want that to happen. That's a big safety thing. So that is my spiel for kind of pre-op nursing. I hope I went over maybe most of the things that you guys might have questions about. If not, definitely drop them in the comments and I can answer those questions. And so we have a safety thing where everybody has to go green before the patient can go back. So the surgeon, after they talk to mom and dad and the patient, they have to go green, make sure that the consent is signed and is signed and is witnessed, and then they go green. Anesthesia comes by. They talk to the patient and the family about what is to be expected with anesthesia, what to look for, how the child might wake up, different things like that. Then they go green. The operating room nurse, she'll come by, she introduces herself. She also does a double check with the patient and the family for first and last name, birthday, and the procedure. I give report to her, she goes green. After all of that is done, I go green. Then the patient can go back and then they get outed and then they have their surgery and then they go to PACU. So I will go into PACU in just a second. Okay. So PACU nursing, or post-anesthesia care unit nursing, that is after the patient or person or child or whoever's getting surgery is out of surgery and you are recovering them from anesthesia. So basically you are, watching their vital signs, their oxygen levels, different things like that. If they come out with what you call an artificial airway. So it's a device that they put in your mouth to keep your tongue down. So for us, a lot of kids come out with that in pediatrics sometimes they don't. If they do, we are now one-to-one with that patient we cannot move, we cannot do anything. So, you know, it's important to have things ready for your patient. So, you know, when I'm in PACU, things that I do to get ready for a patient that may be coming in is definitely associating them to the monitor that I'm going to be using so that I can chart their vital signs in real time. I definitely want to make sure all of my things are set up in the room. So suction, oxygen, anything like that that we might need for an emergency. Definitely want to make sure that is set up. So we call it environmental safety checks. So we do those. I also want to make sure that my math is complete. We have to do math, and somebody has to check it to make sure that the orders are correct and the dosages for the medication that anesthesia might order after the patient has left surgery. We have to make sure that they are in safe dose range. So we have to do math on every patient, and somebody else has to check it. So that will make your job a little bit easier once you come out. Now, with adults, we didn't have to do that. It's a standard dosing procedure. We didn't have to do that at all. So if it's orders in there for how much it is, this is what it is. That's it. But for pediatrics, it's a little bit different. And then, you know, we get the patient or whatever. So things to look for. A lot of younger kids experience emergent delirium. So they might wake up for anesthesia, not be completely awake. They might be upset, crying, fighting, whatever the case may be. And so definitely want to read up on that if you're going to be doing PACU nursing in pediatrics. And so it's common, you know, sometimes it freaks parents out because it's like, woo, why is my child acting like this? What is going on? But anesthesia has that effect on kids. We give medication called fentanyl, and that kind of like, you know, restarts the process, wakes the patient awake. Once the patient wakes back up, they are a little bit nicer, because sometimes when 2-year-olds and 3-year-olds come out of that anesthesia, baby, they be fighting, okay? So you definitely want to make sure you're up on your math. You definitely want to make sure you know what your ranges for vital signs are for different age groups. Definitely want to be looking at that. What is normal? What's not normal for a 2-month-old? What is normal for a 3-year-old? That is definitely important. Math is important. Checking your orders, that's definitely important. And then we don't have the typical, sometimes I know that PACUs are set up different. So when I worked in adults, we had stage 1 and stage 2. We don't have that. So we recover our patients all the way through from stage 1 to stage 2, and then we discharge them home. In the adults, sometimes they have stage 1 and stage 2. So stage 1 is basically, I'm coming out of anesthesia, I'm waking up, I want to make sure your pain is under control. If I can get you eating and, you know, drinking, we start with clear liquids. I would give like crackers and stuff like that to an adult. But for kids, since anesthesia does make you nauseous, we start with clear liquids. So popsicles, apple juice, ginger ale, things of that nature, we give to the kids when they wake up. Once they're up and talking, you know, if they, you know, downed a ginger ale or ate a popsicle or has some apple juice and the pain is under control, we go to stage 2. We're educating the parents on discharge instructions, how to care for their child at home. Boom, we get them out the door. It's fast, but most times I haven't in PACU. I have to say I have it's pretty sweet. It can be hectic, but you know, on a busy day I might only see 5 or 6 patients, and then have the rest of my hours where I'm chilling and not really doing much. And so I work 9 a.m. to 9 p.m. and I mainly work in pre-op. And you know, for me, a day looks like, you know, I hit the ground running, but by 3 o'clock, most of our patients, majority of our patients are done being processed. Now we might have emergent cases or an add-on from the hospital or something like that we have to take in, which is fine. We do our phone calls to the parents. A lot of people or hospitals don't do phone calls. They have an automated service, I'm sorry y'all, to call out to people to give them instructions about when to stop eating, when to stop drinking, what medications to stop taking, etc. We have not got that advance in technology, so we call the parents and give them the instructions. Once all of those calls are done from 6:30 to 9 o'clock, I'm chilling. So I take that time to do homework, take that time to maybe edit a vlog or put up some things on my website, different things like that. And so for post anesthesia, you know, and I know I kind of just jumped around a little bit, I'm sorry. But for PACU nursing, definitely want to be up on your critical care because PACU is considered critical care. So knowing how to manage different things, how to manage drains, how to manage wound vacs, that's definitely a big thing. What to look for with the most common surgeries that you're getting, those different things like that. And I didn't know all the surgeries that we were going to have. Half of the stuff, I was just like, dude, I don't even know what this is. I've never seen this before. So definitely educate yourself. We have education and lexicon. Definitely read up on it so that you know more about it. And so I hope I answered you guys' questions that you've been sending me on Instagram. And sometimes people ask me in person, like, how do we get there? How do we get there? You don't necessarily have to have a critical care background. There's a lot of nurses who have come from the surgical care floors or different things like that and have transferred down to the PACU or to pre-op with an extended period of orientation. And they do really well. Mostly, especially because, you know, surgical care, those are the nurses who we just, you know, if we have inpatient patients or patients who were outpatient or coming, you know, from home and then have to stay overnight in the hospital after their surgery, those are the nurses who get those patients that we send upstairs. So they definitely do well there. But, you know, critical care doesn't hurt. So I hope I answered all you guys' questions. I hope that I didn't talk too fast or you got lost about it or anything like that. If you did, I'm sorry. And if you have any other questions, definitely put them in the comment box and I will get back to you guys ASAP on the answers. You can also find me on Instagram at YouReadyBee, slide in my DMs if you have extra questions on top of what you've seen here, or, you know, drop them in the comment box like I said. So thank you guys for watching. I appreciate you guys. I hope this was educational. Definitely a great specialty to be in. I definitely upped my pay when I got there. From ER to PACU, I definitely am making about $4 more than I was working in the emergency room. So that ain't ever hurted nobody. I have a great schedule. I work only Monday through Friday, 3 days a week, not every day, not 5 days a week, 3 days a week. I rarely do weekends. I don't work holidays. I am occasionally on call and occasionally work weekend. However, I've only worked one weekend shift for the last year and 3 months that I've been working in PACU. I worked one Saturday. Amazing. So if you are interested in pre-op and PACU nursing, I say you go for it. It's great. It's definitely a great schedule. I get to see my family on holidays now and on weekends. And when I was working in ER and med-surg, I can't do that. I missed out on Thanksgiving or I missed out on Christmas. Now I get to see them all the time. So thank you guys for watching. Please don't forget to like and subscribe. Stay tuned for the next video that's going to drop on Thursday at 6 p.m. See you guys.